Hi everybody, Dr. Kristen here. Today I wanted to talk with you and share a very common conversation that I've been having this week with my patients in regards to their low back pain, neck pain, tension headaches, jaw tension, whatever their ailment might be. I've been having this conversation pretty frequently. So I thought if my patients could benefit from it, then I wanted to share it with you guys as well so you could benefit too. So this conversation with my patients was kind of relating their pain, whatever pain that they were experiencing, to a scab, okay? So I recently read a blog from another chiropractor who was talking about Craig Liebenson's work. So Craig Liebenson is a very, very knowledgeable practitioner, and he really helps his patients kind of take control of their pain and gives them things that they can be doing at home to kind of heal and get better and feel better and move pain-free. So the basis of this blog was relating your pain to a scab on your skin. So I know this sounds pretty crazy, but bear with me. So what happens when we have a scab on our skin and we pick it and we pick it and we pick it? Well, when we pick the scab, it starts to bleed and it's got to start the healing process all over again, right? And so it takes a little bit longer for it to clear up, for it to heal, and for it to go away. Well, you've heard me talk about this before, but this just fits really perfectly with this whole scab idea. So I talked to you before about how the most common cause in aggravation of low back pain, neck pain, and things like that are the incorrect posture during everyday activities. So that means, bending down, not bending at the hips when we bend down to pick something up, rotating and bending to pick something up, bending forward to tie our shoes, sleeping on our stomachs, all of these things that we do throughout our day that cause us pain, okay? Every time we do a movement that is painful, we are essentially picking the scab, right? Okay, so if we have low back pain and bending down to tie our shoe creates back pain, then every time we bend down to tie our shoe, we are re-aggravating the low back and picking that scab and allowing the body to kind of start over. So one of the things that I do with my patients is, help them identify those things, because a lot of times, as we run through our day, we don't think about it. We're just mindlessly going through our daily habits. And that's the one thing, the first step is to kind of just take a step back and having somebody point out, well, you told me when you bend down and touch your toes this way that you get low back pain, or when you look over the shoulder this way or reach back in the car this way, you get pain. So part of my job is to kind of point those things out to you so that you're more aware. And so when you become more aware of something, you're better able to change it, okay? And then part of what I do as well is to kind of give you new ways and new postures that you can then do those activities still, but in a pain-free movement. So the more that we can do pain-free movements, the more that we give our body a chance to heal, right? So if we can tie our shoes in a way that is pain-free, then we aren't aggravating our low back as much and we're allowing our body to heal. Okay, so does that make sense? So in regards to a scab, if we stop touching it, stop picking it, it's going to eventually heal. Same thing with anything in your body, your low back pain, your neck pain, whatever it may be. So part of my job is to point out those things, those painful movement patterns that are re-aggravating your low back pain, and give you better ways to still do those activities but in a pain-free movement. So the more we can do pain-free movements, the better, right? So then we're not going to have those re-aggravating factors and re-flare-ups of the low back and neck pain. However, one of the things that we see very, very often in our office is that you just don't think about those things. You're just running through your everyday because we're creatures of habit. We always sleep the same way. We always bend over and pick up things the same way. As we ingrain those old habits, we need to ingrain new habits. So one of the biggest things in my treatment plan is definitely having you become more aware at home and how you do things. And it's really difficult for some people. And I have a lot of patients that tell me, you know, Dr. Kristen, I went down and I was picking something up and I thought, would Dr. Kristen like that I was picking it up this way? And they'll change and they'll actually remember and hear my voice in their head and you know, pick it up differently. And those little things really, really add up. So that's also why a lot of the times I highly recommend patients come in for maintenance care once they get to a point where, you know, they're not feeling pain as often or as much, and they can do some of those things more pain-free. So I always recommend you know, some type of maintenance care, whether it be, you know, weekly, every 2 weeks, every month, every 2 months, whatever kind of works for you, your body, your schedule, because it's very, very dependent on, you know, what you do at home, your job, and those types of things, whether, you know, you have that constant wear and tear on your body. Because some things like our job, it's just really, really hard to get away with some of those habits. So I always recommend the maintenance care because, you know, I can't control what you do at home. If you're, you know, going back to those old ways or you continue back into those poor postures during everyday activities, then I can only help you so much, but I want to be able to help you maintain where you're at. So although once we get you feeling better and, you know, you continue to bend down and you're tying your shoes back to your old habits, you're not going to feel pain right away. But over time, you know, the continual pattern of doing those movements will eventually lead again to injury, overuse injuries, pain, things like that. So that is one reason why I always, most of the time, recommend some type of maintenance care. So whether you're coming in, you know, every week, every 2 weeks, every month, every 2 months, whatever kind of works for your body, because everybody's different, right? We all have different jobs, we all have different stressors in our life, we all, you know, do different things throughout our day that's different than, you know, the guy next door. So everybody's body is different, but part of the importance of maintenance adjustments and maintenance care is that I can't control what you guys do at home. I can't be in your head all the time or, you know, bugging you to stop the way you're picking that up, stop the way you're bending over. So I can't control kind of what goes on after you leave my office. So, you know, a lot of times we do get back to those habits of, you know, just slouching down, tying our shoe, sleeping on our stomach, things like that. But what the maintenance adjustments do is kind of help reverse that or help prevent it from kind of building on top of each other to eventually you start experiencing like a re-injury and you're starting to feel that neck pain or that low back pain again. So I hope that makes sense. I know that was a lot for today, but I've just been having that conversation pretty frequently this week, so I figured it would be very, very beneficial and very important that you heard it too. So if you have any questions or need any tips or tricks to, you know, tying your shoes or sitting down in a chair or getting up out of a chair, feel free to reach out or schedule an appointment with me. I'd be happy to help.